Good morning, everybody. It's a nice pleasure and honor to present this workshop in St. John Clinical Hospital. It's a great opportunity to present our experience. It's well known in, not only in our country, but also internationally. And this is a workshop that, yes, please, the slides. It's a workshop in which we present our experience. I put here in this slide our experience from about 35 years, and you can see 12 laser, for example. And the next slide, please. The next slide. The next slide, please. Yes. And here is our team. I put my colleagues, young colleagues. They work a lot. Everybody from here is working. They can make ureteroscopy, and you can see 16 from our department, from our clinical department. That it's quite good, and I am so grateful to this young urologist to be here and to work together and to try to apply the new technologies. That's why we choose together 2025 experience and of course perspective for 2026. And the next slide, please, is it's very important slide. You know, together we are very strong. And you can see here the companies, I think the main companies in endourology in the world. And you can see here Pusen, Storz, Welid, Clearpetra, and of course Quanta System, Olympus, Boston Scientific, Hawk. You can see also Dornier, of course, and Cook, and HugeMed, and Sobmedica, and of course Iordache. It's in this moment, I think it's really a very power team, and also I am very grateful to the Romanian representatives. They are wonderful. We work together, and they represent, like you can see, these companies, great companies in the world, and of course it's a great pleasure to work together, and that's why we have now the chance to present this workshop online. The next slide, please. Yes, so I put here 5 lasers, only one example, and you can see the lasers from Storz. We have a great collaboration with Storz over 20 years. And of course, I put here Dornier. It's Thulio. It's one of the best lasers. And I appreciate a lot. And also, you can see Quanta System. It's a family. It's a great family. And here you can see, of course, the dust fiber. I mean, TFL, it's really in our hands. We obtain great results, and also it's Magneto. Magneto is, you know, it's one of the best, and we are so proud to apply here the Magneto technology. And also, it's a laser from Wolf. This is our laser for everyday working, and we appreciate a lot. It's also based in fact it's Quanta also. Now it's the first case, and for the first case, please introduce the first case.
In this case, we will perform surgery on a male patient of 59 years with a pelvic stone of 18, 16 and 10 millimeters dimension, with a stone volume of 1,600 cubic millimeters, a stone density of 1,400 Hounsfield units, and of course negative urine culture. As equipment, we will use a flexible ureteroscope, a single-use flexible ureteroscope from HugeMed HU30M of 6.3 French diameter and 3.6 French working channel, with an access sheet with suction Elephant 4 from YiGaoMed, an IRP control system Tidor from YiGaoMed, a Polaris Ureteral loop stent, and of course Thulio laser system.
So I have to say that the technical support was absolutely impressive. I appreciate a lot. Very good technical support. And now you can see we are in the ureter, and it's very clear. We can enter into the ureter. You see, it's very, very, very clear. Now we can enter into the ureter. Yes, and you can see perfectly the stone. What about the stone? It's a big stone, it's a large stone. Especially we choose this stone for this first clinical operation, okay, you can see here. And also you can see that, you know, it's a movement, the respiratory movement. This is a real problem sometimes. So you can see now, please, you can film, it's a trick. It's a little trick. You can see now it's fixed. Look, you can put to the camera out. Yes, you can see he fixed the kidney. So now if you look, move to the internal camera, I mean endoscopy camera, please. Yes, now it's perfect. You can see perfectly the stone. So they already fixed. Please move here. You can see now, look, IRP is 1.6, very, very low. And you can see the irrigation and also the suction. It's automatical suction. This is a great, great technology. This is the stone and this is the fiber. And we, as I told you, we will try to destroy this stone, to disintegrate with this Thulio that I told you. It's one of the best. And look to how it works. Please fix my kidney. Let's see. We started to, it's a little bit, the movement is very impressive, you know. Sometimes it's difficult to work with this in such cases, but look to the, you know, the possibility to disintegrate the stone, it's great. You know, no big fragments, only very, very, very nice the possibility to treat this stone, you know. The movement of the patient is quite interesting. It's not a problem. Let's go. Yes. I will try to fix this okay. Okay. Sometimes it's a real problem, this movement. We try to fix this, you know, it's a human fixing. It's quite interesting. So I am obliged to destroy this stone like this, help a lot by the movement of respiratory. Yeah, we'll try. You have to fix this. Okay, now it's better. Keep like this. Keep like this. It's perfect. Yes, please. Now it's better. Yes. Look to this laser. It's absolutely impressive. Very clear, very clear, very clear. The disintegration is very, very fine. Look. It's worked perfect, perfect. And the laser, it's absolutely amazing. I like a lot Thulio. in one of the best, this combination of thulium, solid state. Solid state. Very good. We continue. No moving, please. Okay. This is one, and now it's better. You can see the stone is not so moving. It's not so moving. It's okay. Now it's better. Look. Now it's better. Really better. Look to the fiber. Is non-contact this laser. You can see perfectly how it works. Yes. And look to the pressure. It's very good pressure. IRP is perfect control. So I don't have any problems with the intrarenal pressure. This is so important in such cases. You know, it's an important case. It's a great stone. It's a, you know, it's a big stone, but with patience and with good technology, you can treat. But you need patience. Patience and be careful. Be careful with the fiber. It's working okay. Now it's better. Now it's better. I like a lot now. Look, precisely. This is matter of millimeters. Yes. Okay, so now yes. Yes, this is important to see. Huh? Okay, sometimes in these cases, you know, it's I will show you the, yes, I will show you the sensor. Where is the sensor? I will show you the sensor. The sensor is here. Look, this is the sensor. And sometimes in this sensor could be a stone. So sometimes could be problems. But it's not a stone. Maybe it was a little stone. Now the pressure is perfect. Now we'll come back to the kidney and the stone and go. Exactly like I show you. This is another calyx. We are very near to the Pyelic wall, but everything is working perfect. Now it's a little bit, it's not a problem. Now you can see the stone, it's a little bit, is moving. And now it's possible to treat the border of the stone. You can see now it's opened the window. Look, very nice case for demonstration. It's a large stone, obstructive stone with calyx, obstructive calyx. It's a stone that, you know, sometimes you need to sink a little bit. Now look to the calyx. 1 hour and 30 minutes. This is one of my main message also. Don't treat a stone more than 1 hour and 30 minutes. It's too much. Of course, nowadays we have this technology like you saw. I mean the intrarenal pressure control and the irrigation control, and of course the suction control. These three are in the same time in this technology that you can see here. Look to that laser. You know, it's you remember our holmium lasers. I mean classical holmium, not the new one. You know, it's a tragedy. When you treat the stone, it's a it's first of all a lot of big fragments appears everywhere in the kidney. So this is not good. This is really a problem. We are very close now to the superior part of the stone. It's here. It's okay. We are here. Okay, be careful. Here and from here. You can see very well how it works. Very well. And essentially in this case is, you know, the possibility to have a great laser. Without this laser is not possible. Okay, we treated a lot of stones with holmium lasers, yes, but it was more difficult, more difficult. This is the last part of the stone, and you can see now the, look, this is the last part. It's, look, it's completely, almost completely done. And now you can see this stone. We will treat this stone also. Okay, I change a little bit the power. This is another mode of treatment. Is not dusting, is fragmenting. In Thulio, look, this one. Okay, great. So, this is the final aspect. Look, it's completely free. It's a real demonstration of the possibility of this technology. Look to the intrarenal pressure, 27. Look, this is the pressure, 20. It's great. Did you see the pressure? And the automatical system. Okay, this is final aspect of the Pyelic system. There are some little fragments there. Okay, because of reason of time, I have to go to the, I don't know if this access sheet is coming in the, no, it's too short. Stones that are coming with me, look, they are coming with me. Look here, this is the irrigation system and also the suction system. Look, out. Look, this is free, completely free, no stones. No stones here, okay? All the stones were aspirated. We will move now to the second operation in another room. We have 4 operating rooms.